Hello, everyone, and thank you so much for joining me today. For those of you that don't know me, my name is Sarmay Felicity Farajafard, and I am currently a senior dental hygiene student here at University of Pacific Arthur A. School of Dentistry. So let's get started on my senior project. So my topic today is going to be on enamel erosion and periodontal disease in the adolescent age group. So I can first start off with talking about my inspiration for this topic. So I grew up in a small town where adolescents in my age had societal pressure, men and female, to look a certain way, to act a certain way, and to be a certain way. And now you can imagine that this caused a lot of great amount of stress on everybody, and unfortunately has led today with me knowing a lot of people that are struggling with eating disorders. And I thought that now that I'm in hygiene school, I can link my passion for being an advocate for eating disorder patients and the oral health and linking it kind of together. So I'm going to be talking about the introduction of my paper, the signs and symptoms of periodontal disease, the objective of my study, different therapies that are involved, and lastly, the conclusion. So I can start off with my introduction. So the American Psychiatric Association defines eating disorders as illnesses in which the people experience severe disturbances in their eating behaviors and related thoughts and emotions. More people with eating disorders typically preoccupy their minds with their food and their body weight. The three disorders that I'm going to be talking about are anorexia nervosa, bulimia nervosa, and binge eating disorders. Although eating disorders affect the adolescent population nationwide, I believe this topic is not discussed enough. Studies have shown that it affects 9% of patients nationwide, and that is 28.8 million Americans. During my time in my hygiene program, I have learned that not only do eating disorders affect the systemic health, but the oral health as well. Now, the dental office may, as we all know, cause feelings of unwanting anxiety and feelings because of the barriers of these anxiety. Clinicians are not being able to help these patients because patients do not want to talk about it or come forward about these disorders. My goal is to educate the patients about period disease and other manifestations associated with eating disorders and to make the patient feel more comfortable to come forward to us. The objective of my study was to review current literature review of different therapies for adolescent patients with oral manifestations of eating disorders and explore whether these therapies can prevent the development of period disease in the future. As clinicians, I think that we can all make adolescents feel comfortable to talk about their struggles with this disease and educating them and providing the resources that they need to get the help that they need. So let's move on to signs and symptoms of periodontal disease. So this includes erythematous tissue, bleeding on probing, clinical attachment loss, calculus levels are high, bone loss, and lastly, enamel erosion. And enamel erosion is the first clinical sign that we can see as clinicians to maybe have that possible linkage between an eating disorder. And I'm going to be moving on to the different types of eating disorders. The first one I'm going to be discussing is bulimia nervosa. So one of the first symptoms you can kind of see or signs is you can see calluses on the back of their hands from the self-induced vomiting that they proceed to continue to do every single day. And also enamel erosion, tooth sensitivity, cavities, periodontal disease, all those things may occur on those patients. And then the next eating disorder is going to be anorexia nervosa. And these patients have a constant battle in their head with food and their body weight. So they have image issues. So looking in the mirror, they think they're fat. They do not want to eat. They always have to be covered in warm clothing because they do not have enough fat cells to be able to protect them. And lastly, the eating disorder I'm going to be talking about is binge eating disorder. So that is when patients discreetly eat a large amount of foods in a short period of time, and they continue eating until they start having stomach pains, and then there's just feelings of regret and sadness and anxiety that comes and follows with it. So there are different types of therapies that are allowed for these types of patients. So one of them being cognitive-based therapy, which is a psychological therapy that has shown to be very effective with other disorders such as substance abuse or marital problems or psychological problems. So it's shown to be an effective study. Another one is family-based therapy, which has been shown to be the most effective for patients with eating disorders because of the adolescent age group. Family and support of friends is super important for them to be able to get through this feelings of anxiety, and they don't feel that they're loved or they're welcomed. So this has been shown to be the most effective therapy. And lastly, what we offer nutritional counseling to set goals and aspirations about what they're going to do and steps that we can help them take to stop the malnourishment that they are currently having. And after reviewing these several studies and continuing my research on the association between enamel erosion and periodontal disease, I definitely think that there needs to be more understanding to have the better access and understanding for clinicians and patients on how we can get through this together. As healthcare workers, we can help them overcome these barriers by asking open-ended questions, providing resources for them, and developing a safe environment and letting them know that we're their friend. And I would like to let you guys also know that not only will this make a positive impact on their lives, but we can actually save their lives. And I would like to thank you all for listening to my presentation today. I would like to acknowledge Professor Lauder and Professor Dr. Tolovora for guiding me through this process and giving me their mentorship. Without you guys, I wouldn't be here today. So thank you.